So then on to our final presentation of this session, and I'd like to welcome Helen Taylor to the podium. Helen is also from the UK. This time we're going to Newcastle upon Tyne. And Helen is going to present on the accessibility and feasibility of a primary care health check for autistic adults in England. And these are the evaluation findings from questionnaires and interviews that Helen conducted. Thank you very much.
Hi, yes, a very short title. So I'm going to be talking about a primary care health check for autistic adults that we've developed. And really, this is a study that is led by Professor Jeremy Parr and Dr. Barry Ingham, and I'm presenting on behalf of the whole Health Check for Adults Consortium today. So just to get into the background, we know that autistic people commonly experience physical and mental health conditions, and we also know from the research that there's significant barriers to accessing healthcare, so things like communication and sensory differences, and also a lack of awareness and limited understanding of the needs of autistic people within healthcare services. So this leads to increased and earlier morbidity, lower life expectancy, and avoidable mortality. So we co-designed a health check with autistic adults, carers and supporters, and health professionals, and we aimed for this to help to overcome some of the barriers and to try and reduce the health inequalities. The health check we've now tested within a large randomised controlled trial. The aims of that were to very much look at the acceptability and feasibility of delivering it in the NHS in England, and also to look at evaluating the clinical effectiveness of the health check itself. So this is part of a wider research programme that started back in 2018. We've had various stages of the project looking at research priorities, thinking about reviewing the literature, co-designing the health check, and then, like I say, we've now tested it. All of these are available in open access journals, each of them written up, and they're available on our website, which I'll show at the end. So in terms of the randomised controlled trial, we involved 52 GP practices. So for those that aren't familiar with the English system, it's family doctors, local community-based care, not hospital care. So they were located in the north of England, and we had 26 who delivered the health check, and 26 practices provided care as usual. We had 226 autistic adults took part, and those adults were 18 years or over and had a formal diagnosis of autism, so that they were able to be invited by their GP practice because they had to be able to identify them on the system. In terms of the measures, we gathered questionnaire data at baseline 3, 6 and 9 months. We also gathered information from the individual's primary care health records, so their electronic system medical records. And we also gathered questionnaires and invited some people for interview who had received or delivered the health check as well. In terms of the participant flow, we just wanted to put this up really, I suppose, just to show that we had high retention rates throughout. So the follow-up questionnaires were completed by at least 80% or more, and we had a large number we were able to find the primary care health record data for as well. So in terms of the health check itself, it consists of 4 parts. So primary care training for primary care staff, and that looks very much at autism and the barriers to healthcare access for autistic people, and also the health check delivery. Participants were then sent a pre-appointment questionnaire by their GP surgery, and this was completed before the appointment, and it covered things like their communication and sensory needs, the opportunity to request reasonable adjustments within the appointment, and also their general health and well-being. So just to show you an example, which probably is a little bit hard to read, but there was a paper and a digital form, and you could request through ticking boxes certain reasonable adjustments or share your own, and also provide some information about some commonly experienced problems. In terms of the health check appointment itself, it was an extended GP appointment because obviously they are pretty short. So it was a very extended appointment with an appropriate clinician, and they used a health check template in the appointment and the pre-appointment questionnaire to kind of go through areas that were relevant for the particular person. So just to show you a bit of an example, it included prompts around a range of areas like physical health, mental health, personal life, so things like living situation, employment, caring responsibilities, and also services that people were accessing or their support needs. And the last part of the process was jointly developing a health and wellbeing action plan between the patient and the clinician at the end of the health check. And that really looked at identifying the key needs that had been found during the appointment and actions to kind of address those. So it might be signposting to particular services or referring on for further investigation or calling the person back regularly to kind of review and monitor. So in terms of the acceptability and feasibility, of the 95 health checks that were delivered as part of the trial, we received evaluation questionnaires back from 81 autistic adults, 11 carers and supporters, and 18 health professionals completed 71 questionnaires about the health checks that they delivered. In terms of the interviews, we interviewed a subsample of each of the stakeholder groups. We had 24 purposefully sampled autistic adults, 5 carers and supporters, 11 health professionals, and 4 non-clinical staff who supported the process. In terms of the interview data, we did some thematic analysis to understand the experience of the health check, and we also did some normalization process theory exploration to kind of understand the factors around implementation that would be important. So just to give you a bit of information, so the pre-appointment questionnaire, most people said it was okay to complete. Half did it on paper, half electronically. 30% had some support to do that, just to understand questions or to provide some of their own health history. The majority found it really useful to share information about their communication needs, about their current health concerns, and their general health and well-being. And in terms of the quotes on the right-hand side, you can see that both clinicians and autistic adults were saying really that it was really helpful to give that information before the appointment, so there was a bit of awareness and shared understanding about what it would involve. Personalising the healthcare appointment, so 46% requested one or more reasonable adjustments, things like natural lighting or dim lighting as shown in the quote. The adjustments were reported to help very much with feeling calm and comfortable at the appointment, sharing information with the health professional, understanding and following advice, and making waiting easier. Clinicians told us that they found it relatively easy to implement the reasonable adjustments and they didn't really require any additional resources. And really we got strong messages about how important it was to have those reasonable adjustments in place and in familiar settings to reduce stress. In terms of the health check appointment itself, it generally took on average 58 minutes, which I appreciate is longer than a normal GP appointment, but very much the clinicians involved saw the importance and the breadth of it. 92% completed all relevant sections on the template. Where they weren't completed, the sections, it was often that there'd been recent contact that had already covered that they were focusing very much on the personalised approach, so the important concerns to the patient, and managing the length of the appointment. Most of them produced a health and wellbeing action plan, and about a third took somebody with them to the appointment. So autistic adults told us they felt listened to, they were able to talk about mental health, physical health, their general well-being and social needs, and also carers and supporters said that it was really helpful that they were included and that they were able to offer reassurance and help share information at the appointment. In terms of the primary and secondary outcomes, we found that the health check was clinically and statistically significant in producing, in terms of the primary outcome and 2 of the secondary outcomes. So it identified and met almost 70% more health needs. So things like musculoskeletal disorders, mental health conditions were identified and then able to be treated. It also identified twice as many health promotion needs, and they were able to then be addressed. So that's things like lifestyle advice, opportunities for improving health and well-being through an intervention. And it also identified twice as many social needs, so they would be things like housing advice, employment support, financial support, that sort of thing. So it allowed signposting across to those. It also identified more health monitoring needs, so things like diabetes and hypertension, but that wasn't statistically significant between the groups. So really people talked about it being a really useful tool where it was allowed for this sort of holistic conversation about physical, mental health, emotional health, and a safe space where people felt they could talk openly. And clinicians said to us that they were able to meet and address a lot of unmet need for this population, so they thought that was really, really useful. It was a mixed method evaluation as well as part of the study, and so looking at the experience of the health check, generally speaking, all stakeholders were very positive about the experience. People were generally positive about the pre-appointment questionnaire, although some people didn't see the value as much because they didn't feel they had a need for reasonable adjustments and they didn't have any health concerns, so they chose not to fill it in. Autistic adults very much talked about wanting and valuing the reasonable adjustments that were implemented, and the autism focus of the health check allowed the experience to be a more positive experience than previous experiences in primary care services for people. People talked about leaving feeling reassured and with lots of actions to follow up on, which was really, really helpful. And in terms of the implementation, there was very much agreement on the value and the need for the health check for autistic adults. They talked very much about the need for sort of clear engagement and communication about what the health check involves. So thinking about very clearly communicating the purpose and the scope of the health check, just to ensure the kind of consistency across services and to manage patient expectations about what they were coming for. One thing that came out strongly was that primary care staff training is vital. This was really, really helpful to be able to kind of, I suppose, highlight the need for a flexible patient-centred approach. It also highlighted the opportunity to use reasonable adjustments and, where appropriate, kind of carer and supporter involvement to really facilitate not only the access to the health check appointment, but also the engagement during it. Clinicians also talked with us, I guess, about the importance of adequate resourcing and funding in order to be able to deliver this, because obviously it was an extended appointment, and so actually it needs support systemically to be able to kind of continue to offer this. So in terms of conclusions, we found that it was acceptable and feasible to deliver in NHS primary care in England. It did help improve healthcare access and engagement. It produced clinically and statistically significant health and social outcomes, and very much the value and the need was recognised by all stakeholder groups. So on the whole, a really positive response. We've highlighted a number of important factors for implementation for taking this forward in the NHS. And actually, it times quite nicely with the recent publication of the NHS 10-year health plan for England, which came out just recently, which very much focuses on prevention and health promotion. It promotes local community-based care and digital technology. And so all of those things are embodied within the health check that we've co-designed, which is great. It also provides the opportunity, I suppose, as well, to think broadly about other countries as well and their healthcare systems. And this is something that could be looked to be implemented much, much wider than the UK. So just a final thanks to our funders, Autistic and NHS England, all of the study participants and the GP practices that took part and gave up their time, and all the people who helped us to deliver and run the study, as well as the wider consortium of members who involved in the study team, both past and present. And finally, just if you want more information, please visit our website, which is on there. Like I said, the papers are available through there, and we're going to be putting more resources on there shortly as well while we're producing them. And I'll be happy to take any questions.
Thank you very much to Helen. Are there any questions? I know we're at the very end of the day. We sometimes refer to this as the graveyard shift, but somebody said to me recently that it's the cheese and port course at this point. Well, again, I'll just close maybe with the question I had. I'm sorry if you maybe covered it, Helen, but just wondering, the GPs that participated in the extended appointments, was that all GPs or only those that bought into this, or was it a pilot cohort? And is it a programme that you see being broadened out to all GPs, or will it be a cohort that have the skills for that extended appointment? Yeah.
Yeah, so I suppose in terms of the trials that we've just done, we invited a large number of GP practices within the north of England to take part, and obviously we worked with those that responded positively to that. So there were some that didn't choose to take it up, and often that might have been partly because it's a research study. There are other research processes that they have to get involved in. It's not like just putting it into usual practice. So that there's some time intensity practices in terms of that. So we worked very much with those. I think those that came on board were very positive about the opportunity for the training, the opportunity to use a tool and to get to really explore the needs of this particular population. And I suppose we worked with, it wasn't just GPs that delivered it, nursing staff did too, and some health care assistance as well. But really we were trying to encourage GP practices as a whole to take on board the training and the understanding, I suppose similar to what the talk before me talked about, in it being the admin staff, reception staff, all of all of the GP practice. But yes, certainly we're meeting with NHS England and NHS Scotland at the moment going forward to look at kind of how this could be implemented within the wider UK, I suppose. And again, we're keen for any opportunities to talk with anyone else from other countries about how we could potentially take this forward there as well. So please do get in touch if you're interested. Thank you.
Thank you. So thank you again to all 4 presentations in this session. I think it's really exciting to see how the research is transforming into really practical applications, really practical programs, practical supports for autistic people. I work with children and young people, and I know one of the biggest challenges is getting those children and young people to medical appointments. And I think all that we heard today is going to be so proactive in helping from children right through to adults. So thank you to everybody. So that closes our sessions for today, and we look forward to seeing everybody back tomorrow for day 2. Thank you, everyone.